So PANORAMA itself is a global phase 3 program. It's a multi-center randomized trial in which 402 patients were randomized equally to one of 3 arms. First arm was sham injections, and then there were 2 dosing frequencies of aflibercept. And the aflibercept dosing frequencies were every 16 weeks or every 8 weeks after 4 and 5 loading doses respectively. And then the primary endpoints were at both month 6 and at month 12. And the primary endpoint was the proportion of patients with 2 or more step DRSS improvements. So it's basically a color fundus photograph primary endpoint looking at improvement in retinopathy severity scales. A key secondary endpoint was to look at the development of vision-threatening complications, so proliferative disease, center-involved DME. Enrolled patients were anti-VEGF treatment naive with good visions. They had 20/40 or better visual acuity with no center-involved DME. And speaking to that, at baseline, the average visual acuity was 20/25. Just again to emphasize, these are well-sighted eyes, and their central retinal thickness at baseline on average was less than 250 microns. So there's no DME in these eyes, and they're well-sighted. Very unique population from what most of the anti-VEGF trials have looked at, which are mostly DME patients. And at baseline, just to round out the demographics there, the A1C was about 8.5, and then there was about a 14-year history of diabetes. So obviously these are all diabetic eyes with NPDR without DME.